Sickle cell anemia. I'll tell you a story. Aminat was just 22 years old when she died, according to an interview with Punch newspaper. Her mother had described her as a warrior and having fought through crisis after crisis. Her mother said that Aminat had bade the world farewell when she least expected it because she just came out of a seemingly worse sickle cell crisis. Now, I'm sure many of you are very familiar with the term sickle cell or sickle cell anemia. Now, it's quite a familiar red blood cell disorder in the society, and today we are going to be discussing about it. So, welcome to the Health Show. And before we proceed, remember to like, subscribe, and turn on the notification bell so that you don't miss any episodes of this season. Now, sickle cell disease, or SCD for short, is a disorder that causes the red blood cell to mishappen, change shape, or break down. Now, red blood cells are the most common blood cells in the body. Their main function is to carry oxygen from the lungs to other parts of the body. Now, in talking about SCD, we have to analyze genotype. Firstly, your genotype. Your genotype determines the health of your red blood cell. You see, genes usually come in pairs, one each from a parent. Now, these genes are known as genotype. We have the common ones, which are AA, AS, SS. Now, if you don't know your genotype yet, please make sure to go to a test as soon as possible. Now, a study shows that the AS genotype is usually a carrier of the sickle cell. It is also known as an abnormal genotype. And like SS, it also has a sickle cell gene. Now, people with the AS genotype got the hemoglobin S from one of their parents and the hemoglobin A gene from another. Now, these people usually do not show any sign of sickle cell disease. However, in rare cases, there have been some reports of health problems, which are usually due to body stress or other factors. Now, let's take a look at this diagram. Now, the diagram shows a simple representation of the normal red blood cell and that of the sickle cell red blood cell. Now, we can see how deformed the sickled red blood cells are. Now, this abnormality make it difficult for the cell to carry oxygen from the lungs to other parts of the body, as it can get stuck while they are traveling through blood vessels. Now, this can cause excruciating pain in the affected part of the body where this is stuck, and usually this is referred to as crisis. Now, secondly, the complications. Now, a study claims that the leading causes of death in sickle cells are infections, acute chest syndrome, pain episodes, and stroke, which are some of the complications of the disease. Now, people with sickle cell disease start having a symptom as early as 5 months of age. Now, this symptom varies from person to person and can range from mild to severe. Now, painful swelling in the hands and feet is known as hand and foot syndrome, and usually the first symptom of sickle cell disease in children. Now, this swelling, along with the fever, is caused by the sickled red blood cells getting stuck in the blood vessels and blocking blood flow into the bones of the hands and feet. Now, this complication also affects adults with SCD. Now, there's been some speculations going around that patients with SCD may become drug dependent or addicted if their pain crisis is treated with narcotics. However, there have been no scientific evidence to support this claim, and patients with diseases can only become addicted if they practice self-medication. Now, living with such condition without proper support and care can be a nightmare, especially for children, as it becomes unbearable for the little ones. Now, this is why it is very important to know you and your partner's genotype before thinking about marriage or having a child. Now, you have to be sure that you both are compatible so as not to bring a child to this world to suffer. Now, living with such health conditions is quite expensive financially, mentally, and emotionally. And this is why it is important for those living with sickle cell disease to have a strong support system, and be it family, friends, loved ones. Having people who care and understand can offer support can make all the difference. Please get to know your genotype and your blood group checked. It is a matter of life and death. Now, every year, an estimated 100,000 kids are diagnosed with sickle cell anemia in Nigeria, and up to 80% die before they turn 5 years. And this is to tell you that you shouldn't let love blind you, no matter your religion and how emotional you are. Know your genotype before you agree to your partner. I'm talking to you now. By understanding the potential outcomes, couples may make informed decisions about family planning and securing a healthy future for their kids. Now, that's out of the way. Remember to check your genotype. Let's talk about managing sickle cell disease for those who already have it. Now, this is to remind you to like this video if you haven't done that already, and subscribe. Now, the treatment of sickle cell disease. Currently, there is no cure for sickle cell disease. However, treatment administered to patients are usually to help the pain episodes and manage the complications that are associated with the disease. Now, medications such as pain relievers, hydroxyurea, and antibiotics are prescribed to alleviate the symptoms and reduce the risk of infection. Now, some of the novel drugs from what I listed are hydroxyurea. Now, it helps to reduce the pain crisis and might reduce the need for blood transfusion and hospital stay. Now, the drug costs about 22,000 naira in some pharmacies. Now, there are other drugs like Endarin and Hospital. It is used to treat the disease from patients that are older than 12. Now, these two medications are taken by mouth and can reduce the risk of anemia and improve the blood flow through the body. There's also the option of bone marrow transplant. Well, it's not for everyone as there are no complications with that process. Now, for foundations that treat SCD, the Sickle Cell Foundation of Nigeria boasts to having one of the best facilities to treat patients battling with the disease with a better chance of a healthy life. The National Sickle Cell Center in another health facility in Lagos. It also helps to treat the disease. We also have the Sickle Cell Anemia Center in Benin City. There's also the Department of Hematology, University of Nigeria's Teaching Hospital, Enugu, and a number of others. Now the list is just it's on Google. You can just Google them to know the one that's close to you. Now there are also some NGOs that are invested in spreading awareness and educating the youth about the disease. Now some of them will conduct free genotype tests in some communities. You can visit your hospital or any hospital near you to get your genotype and blood group checked. Now it involves a blood sample taken away from your arm by a medical professional. The sample is taken to a lab for analysis, and results usually takes about 3 to 8 weeks, which we provide to you once it's ready. And before you leave, I would like to stress the idea of knowing your genotype. Stop loving blindly. No matter the stage of your relationship, check your genotype. If you're not compatible and there's a chance of you giving birth to a sickle cell child, ensure you end that relationship. If your partner is refusing to end it, just look for how to get to you. I'll help you. All right. Thank you for staying to the end. Remember to like and subscribe. See you in my next video. Bye bye.